everyone, it's Dr. Tofi. I'm so happy to be back. Thank you everyone for joining me. I am your hernia and laparoscopic surgery specialist, and we are here live once again on HerniaTalk Live every Tuesday night. Thanks to everyone who's logged in on Facebook as a Facebook Live and following me on at Dr. Tofi, and also thanks to people who regularly talk to me and DM me and message me on Instagram and X, formerly Twitter, at HerniaTalk. As always, this episode and all prior episodes will be posted on my YouTube channel, which is at HerniaTalk. And as you all know, we also have a podcast. So the podcast is called HerniaTalk Live. So do follow me, subscribe to the podcast. You can listen to it when you're driving or working or whatever it is that you like to do, without having to really pay attention to like our YouTube channels, right? You don't really need internet access with a podcast once it's downloaded. So I am a big fan of podcasts. And so I'm really excited that HerniaTalk Live is now a podcast. And it's actually been a pretty successful podcast. We have almost 1,000 downloads already, which I think is nuts, but it is what it is. I'm super excited that people want to be on a podcast about hernias. Anyway, so we've been a little bit offline lately because I lost my voice right after, literally hours after the HerniaTalk Live episode, right before Thanksgiving on Being Thankful. I woke up the next morning and had no voice. Totally did not feel that sick. I just had no voice. It's like a laryngitis. It was some bacterial thing, I think, because it got better with antibiotics. So then I just had to deal with my voice, which, I'm a surgeon and I teach. And everything else I do on social media involves voice, but really I teach and I operate. So I need to talk to people during my teaching episodes and in the operating room, because you give orders all the time, asking for instruments and so on. I had no voice, but I was feeling okay. So once I got over that, I was so excited because I'm okay. The voice I can deal with, but at least I'm not, dealing with the other repercussions of like an upper respiratory infection. And then boom, I got another disease. I think RSV. I don't know if you guys care, but just sharing with you my story. So that is like, I don't know if anyone's had respiratory syncytial virus. It was going around a lot around here, and just like, just lots of drainage, and that made my voice worse. So as you can hear, there's a little crackling in my voice still. It's not perfect. It's not clear, but it's so much better than it was. I sounded like those patients that smoke and drink a lot. I don't know if you it was a horrible sounding voice. It wasn't sexy at all. But long story short, I'm better and I'm back. And I thank you all for following me and asking me what happened to HerniaTalk. I'm like, we'll get there. Just let me feel better. So that was the story. That is what happened. Some of you got to at least interact with me online on HerniaTalk.com. So there is that. I'm very happy that we have a revised website for that. So thank you for that. All right. So on that note, let's start our episode. So today it's just me, no guests. We're going to give them it's kind of Christmas time. We're going to give a break, a holiday to my guests and not put them to work, because they're always volunteering their time. And I'm very grateful to the doctors and specialists and some of the patient advocates who do volunteer their time to come on this episode every week to help answer your questions. So it's just me, and we're going to answer your questions. And I was I came up with today's topic because I was talking to a friend of mine who works a lot with injured patients. So he's a very well-respected surgeon, and people get in car accidents and slip and fall, and they injure themselves, and he helps them get the care they need, usually as a work-related injury. So you've heard of workers' compensation or things like that. Your employer typically has some type of insurance to help their employees with their healthcare costs if they have an injury that was due to their work. So let's say you're working at Walmart and there's a spill on the floor and you accidentally slip and land on your hip, and now you need a hip surgery, or let's say you're at the supermarket and you get carpal tunnel syndrome from the work you do. Often those are work-related injuries. You would not have incurred that injury if you were not working at that specific place, doing the specific demands of the job. And so workers' compensation helps with that. So the question is, what about hernias? So a lot of patients have hernias as work-related injuries, and I'm sent them sometimes, not a lot. I don't really specialize in workers' compensation. I usually get sent the workers' compensation botched hernias. So they had a hernia determined to be related to their work. And then after that, surgery gets botched, and then they send it to me. But let's say that's not the situation. Let's say the situation is you're working, let's say you work for FedEx or UPS, and you have this repetitive lifting, dropping off things, taking boxes, no matter how heavy, from your truck to the door and back, or picking up stuff and putting in the truck. And it's a repetitive action. So there's no good science behind anything I'm telling you, because no one that I know of has really studied it. But the thought is that repetitive motions that involve lifting can induce hernias in some patients. So the same way that not everyone gets hernias, for example, athletes tend not to get hernias, bodybuilders tend not to get hernias because they have very strong core. But those that do get hernias, usually there's a genetic predisposition or some kind of underlying collagen disorder that is making them more likely to get a hernia. So that's kind of the underlying problem, right? But then add on top of that risk factors. So usually on HerniaTalk, we've talked about risk factors, right? What are the risk factors? If you're following me on this, you already know the answers. Coughing, chronic cough, which is what I'll be doing throughout this podcast. Constipation, straining, such as for an enlarged prostate to urinate, and so on. So why do people cough? They have asthma, they smoke, they use marijuana, they get an upper respiratory infection, they have postnasal drip or acid reflux. Those are the commonest reasons for a chronic cough. Well, I tell you, go treat it. Constipation, another major risk factor for hernias. And how do you treat constipation? Take some type of magnesium-based supplement, either magnesium, milk of magnesia, Miralax, anything that of that nature. You can take mineral oil. You can have prunes and dried fruits, and some people, coffee helps them. There are certain teas for constipation. It's mostly natural things, high fruit and vegetables, fiber content, fiber supplements, lots of variety of ways that you can treat and or prevent constipation. So you should not be constipated. That will promote hernias. Work is another one. So there are people that lift for a living. Let's say you're at the airport and you are the person that is constantly moving luggage back and forth. throughout the airport process, loading and unloading and so on. Currently, almost all of that is done by a human. And so that's a lot of lifting. So the same thing that's bad for your back is probably bad for your front or your core, and it can promote hernias. So if you have a job and you believe that something acutely happening because of the job gave you this hernia, then that's considered a work-related injury. Usually it's in like truck drivers, delivery people, or I've also seen it in people who've had some type of car accident or trucking accident. So they were in normal health, they got a bad car accident, and then boom, they look down and, oh, I didn't notice I had this groin bulge or this belly button bulge. And the timing of it is correlated to that specific accident. So let's say you're Uber driver, you got in a car accident. Well, it's possible that car accident, let's say it was not your fault, that the car accident was therefore the instigator of the hernia you got immediately after the accident. In other words, that is a work-related injury. You're a driver, you got in a car accident that was not your fault, and so on. So there's some debate among surgeons how much of someone's hernia is related to their work. Because, and there's a question that was presented to me earlier, I'll answer it now. The question is, I always say exercise, right? Go exercise, heavy lifting is safe. We've measured abdominal pressures with planks and sit-ups and deadlifts and overhead lifts and pull-ups and push-ups and so on. And we have not shown that there's an increase in abdominal pressure from lifting weights at the gym for exercise. And so when people say, how can I prevent a hernia? We say exercise, don't gain weight, do core-based exercises, and that includes lifting weights. So why is it that lifting weights for exercise is considered protective of hernias? But now I'm telling you, lifting heavy objects during work can be a work-related hernia injury. Number one, we don't know the answer to that question. Number two, the thought is the repetitive, two things. One is the repetitive motion, over and over and over again, twisting and pulling and lifting heavy objects is injurious and can cause hernias. But number two, the thought is that when people are lifting things, I often get the story of, I was totally healthy, I didn't know I had a hernia, I came to help my neighbor move, and I was moving their TV, which was very heavy, or lifting their sofa, moving the sofa, which was heavy, and then I felt a pop. That's a very typical scenario that we've heard. I hear a lot. And because I lifted the sofa, I caused the hernia. And therefore, because I'm working at a delivery service and I'm lifting, and then now I have a hernia, then it's because of the work-related injury. So we don't have good evidence to prove that if you weren't lifting, you wouldn't get a hernia. But the way I think of it is, yes, it is true that, and studies have shown that exercise does reduce your risk of hernias or delay your risk of hernias. Because everyone who gets a hernia, typically it's not a trauma, it's usually because of a genetic predisposition. However, why is it that exercising is protective, but lifting weights for your job is not protective? And the answer that I give, and I have yet to hear like an actually evidence-based answer, is when people are working or they're lifting for work or to help someone move or groceries or whatever, they're usually not thinking, okay, I'm going to tuck in my pelvis, I'm going to engage my core, I'm going to straighten out my back. they often do it without any support of their core, without thinking. Whereas when they're at the gym, they're making sure they're protecting the core when they're doing heavy lifting. Because if you're not, you're going to injure yourself. They often don't do it at work. And you see people that have back injuries, the same people who get back injuries from work-related activities are also at risk of getting hernias from their work-related activity. So that's my answer, which is that you're just not doing it correctly. And of course, I'm going to sneeze like right in the middle of my talk. But that's the whole thing, is that if you very conscientiously wore some type of brace and tucked in your core and use your core safely during your job, the chances are that you're not going to get a hernia. So yes, I do believe that car accidents, heavy lifting, and things like that are work related can cause hernias. Often those people already have some type of genetic predisposition to get a hernia, but in some people it's traumatic. There's something called a traumatic hernia. We've discussed this before. You get a car accident, just rip the abdominal muscle off of the bone. The same thing can happen as a traumatic hernia during a car accident, let's say, or an airbag deployment, where your belly is like basically torn at the area of an actual inguinal hernia. So what do you do about that? Well, one is prevention, right? Because there's already enough hernias out there in the world. For sure, an employer does not want their employee to get a hernia. It'll cost them money, and both physically cost them money, but also indirectly by not having a person in the employee working while they're in recovery from surgery, let's say. So most employers want to prevent work-related injuries. And so they should be providing you with a back brace if you're regularly lifting. And, I think some employers actually provide ergonomic education. So sit this way, lift this way, stretch out before you work type things. And then also some of them, a lot of employers nowadays also offer like gym memberships as part of their benefits, because they understand that a healthy, fit employee is going to be safer and less likely to injure their back because they're going to have a strong core. So it's worth it to pay $20 a month for each employee to go to the gym and maintain their weight and not be overweight and have a safe core to therefore come to work that way, than for the average patient who maybe not in good shape or obese and then they get a hernia, because obesity is a known risk factor for hernias as well. So based on that, I personally do believe that there are certain aspects of people's jobs that can promote hernias. Most of them are not traumatic, like a car accident. Most of them are over time, you keep stressing your core and increasing your abdominal pressure, lifting weights, in the same way that you're at risk of hurting your back, which is part of your core, by the way, then you're also at risk of hurting your groin. So I'm going to stop for a second and kind of review some of your comments. Here's one. Thanks, you guys. This is nice. Merry Christmas from Perth. Perth, is that Australia? I think that's Australia. And a huge thank you for your informative videos and responses to my questions, of course. And another one, local, from a great patient. We love you, Doc. You're a blessing. Merry Christmas. Merry Christmas to you. I didn't wear my scarf this time, but I should have. Yes, Australia. So I need to come visit Australia. I know I have a couple of friends there that I've never personally met, but we know each other through our Facebook groups that are Australian surgeons. Actually, I do know one of them. I met one of them several times because he does come to a lot of these meetings, but most of the people that are surgeons in Australia don't leave us, or I haven't seen them leave Australia. But I would love to go to Australia. That would be a great trip. I heard New Zealand's also really cool. So I'd have to visit both. So thank you very much for that. And maybe if I ever do visit, I'll let you guys know. Maybe I can meet some of my followers that are Australian. How cool would that be? Because, last year when I was in London, I did exactly that. I got to meet many of my followers that are in London, or actually some of them were not in London. They were in the UK somewhere, and took a train ride or even a flight down to London, or to technically Manchester, to meet. So that was really cool. And I hope to be back in London next year, and maybe we can do another session. I don't know. That was really cool. All right, some questions are coming up. By lifting something too heavy at work with poor form, which is what I was talking about, that's the right way to describe it, poor form. In addition to injuring the inguinal canal and causing a hernia, can other muscles, ligaments, pubic plate attachments in the neighboring groin or core area be injured at the same time? And would they also need to be addressed at the time of surgery? So that's a really good question. So yes, the same way you can pull a groin from certain sports, usually not so much exercise, but certain sports like hockey, soccer, sometimes basketball. You can also pull a muscle or have some type of muscle injury, muscle or fascial injury during work. Not as common because you need to exert a lot of stress to actually tear your muscle. Whereas the inguinal canal, if it's already open, and if you also have a propensity to get a hernia anyway, then that area is more prone to tearing and becoming a hernia, where you'll see a bulge as opposed to tearing the muscle. So muscle tearing is very traumatic. It can happen during a car accident, perhaps during work, or it can happen during a sports injury. Very uncommon to have a muscle tear from work-related injury. A hernia would be much more common. But you can strain and pull, strain but not tear. So strain is like micro tears. And that can happen from work as well. Usually these all happen with rapid traumatic movements. And of course, there's no real surgery for most strains. They tend to heal and scar on their own. For groin strains, also usually it's not surgical, and you purely need to wait it out, rest it out, and maybe do some injections. Now, the other question had to do with like the basically the pubic plate. Some of what people refer to as sports injuries or pubic plate disruptions are actually just direct inguinal hernias. And that's if you're older, let's say, and you're not really working much, that's just a direct hernia. That's not a pubic plate disruption. You need to actually have a lot of force to have a true sports hernia, sports injury, and it's usually not from work. Follow-up question. If you're doing strength training without a trainer, should you exhale or inhale during the lifting phase or straining phase of exercise? Oh, you're asking me questions I may not be correct. So I have a trainer, and he tells me I don't do a good job of breathing. You're supposed to inhale and exhale during certain points of your exercise, and it depends on the exercise you're doing. So whether it's core related or not core related, if it's lifting or not lifting, the point is to have very controlled breathing, because your diaphragm is also part of your core, and you want to make sure that all of that core is in sync. So I don't have the perfect answer for that. I would love it if you could hold on to that answer, and then maybe I'll bring a trainer. I'll bring a trainer that knows these answers, that can and do a good job of answering them. because it's really important. There is actually next year, I haven't confirmed the date with them yet, but I have this great group of trainers that have some really good information online on hernias that I'm going to invite, and let's put a pin in it and come back and ask them specifically how appropriate it is to breathe, inhale versus exhale at what specific point in time during exercises, and how that would be protected. But that's great question. I do appreciate that. So what happens if you do have a work-related injury? Unfortunately, well, here, let me answer that. Oh, sorry. There's a follow-up question. With respect to the earlier question, if you had an earlier good hernia repair, if lifting with poor form at work, in that, are you more prone to injure other core muscles rather than the inguinal floor? No, not necessarily. Not necessarily. So what do you do once you do have a work-related injury? Well, hopefully if you do have workers' compensation insurance through your employer, you can go through that. So your employer pays a sum of money to secure workers' compensation insurance that is separate from healthcare that you normally have, that's either private or corporate through your workplace. And the reason why it's separate is it doesn't necessarily require like surgery, let's say, but it's intended to be an extra, like a safeguard for your employer. So, and that you should not be paying out of pocket if your injury is work related. Your employer should be paying for that. Whereas for your health insurance, oftentimes that is paid out of pocket, or it comes out of your check or something like that. And if any of you are online right now that are outside the United States, I would love to hear from you if you have a concept of workers' compensation insurance. Please make a note in your comments, because I really want to know what happens outside the United States. Now, there's a lot of countries that have socialized medicine, and the country pays for your health insurance to begin with. So it's not like you have to have private insurance, and then separately your employers need to have workers' compensation insurance, because it's free either way. But what happens is there used to be a lot of fraud through workers' compensation. The lawyers and the doctors, they all kind of got together this is a while ago, and they saw workers' compensation insurance as a way to kind of make extra money. So they would take patients that claim, let's say they had a hernia as a result of, or like back pain, that's the easier one, back pain as a result of their work. They would get imaging and MRI and all these images at an imaging center that would get a kickback, and then they would send them to chiropractics that would get a kickback and say, oh yeah, horrible pain, of course it's from work. And then they would send them to let's say a spine surgeon who would recommend injections or surgery or whatever, and then there'd be a lawyer that kind of or a patient representative that represents the patient that also gets paid. So that was a while ago, decades ago, where there was just this rampant fraud going on in the system. From what I understand, again, I'm not really in the workers' compensation world. I have treated a handful of patients that had botched hernia surgeries that was part of their workers' compensation, and so I kind of had to get involved that way. But nowadays, it's a bit more regulated, and the workers' compensation insurance process is a bit more onerous, which means that patients are not as easily able to get care as they used to. So you have to go through a lot of hoops and a lot of bureaucracy and paperwork to then get the treatment that you need. So I'll give you an example. If a patient has a hernia, first they have to go through some type of legal process, including a lot of paperwork, to substantiate that that inguinal hernia was not there before and was directly a cause of something work related. Often a lawyer is involved or a patient advocate is involved. Then you're sent to a surgeon, let's say me, who says, yeah, you definitely have a hernia and you have symptoms from it. So I would recommend surgery, or you don't have symptoms from it. You can just do watchful waiting. And then they say, okay, you may need imaging. Let's do physical therapy. Let's not jump into surgery. Let's do injections. Let's not jump into surgery. They'll do all these other things. And then 1 or 2 years may go by while you're fighting the system. And finally, they say, you know what? That's fine. Go ahead, do your surgery, send us the bill. And then there's a fight over the bill. That's too much. We're not going to pay that much, or we're not going to approve this doctor. Go to another doctor that's part of the system that does a lot of these things. And time just keeps passing by. There's a lot of paperwork each time, which is why many people with workers' comp insurance that use that are assigned like a patient advocate that will make sure that when the doctor says you need an MRI, that MRI gets done and doesn't fall into paperwork and bureaucracy for another 6 months. Or if the doctor says you need to go see physical therapy, that gets approved immediately so the patient can go start their physical therapy so there's not a delay. And often that patient advocate is paid for by the employer because they just want their employee back at work and healthy. So that's usually the system with workers' compensation. A lot of paperwork, a lot of back and forth. A million people need to approve every single step. However, and therefore many people are like, listen, I just want to get better, go back to work. I have health insurance. I'm just going to go use my personal health insurance. I don't need workers' compensation insurance. And I'm just going to go ahead and just do my hernia surgery with my private health insurance, which may or may not be paid for already by your employer. And so that's kind of the situation. If any of you have been through the workers' compensation process, I would love to hear from you. If you can just make some comments in here so I can kind of hear back from you, because every company is different and every workers' compensation company is different. And I've had good experiences with some where they're like, yeah, the patient's got a hernia. Thank you for repairing them. We appreciate it. Let us know as soon as you think the patient can go back to work. And there are others that are like, we don't want to pay this much, and we're going to send them to another opinion, and then they have a botched surgery, then they have to come back to me, and we had to fill out a bunch of forms, and they have to see other doctors to fill out those forms, and they won't let you. Let's say the patient comes to my office and I say they don't need surgery, they need an injection, let's say. Well, I'll in the typical scenario, if I see a patient in my office and I feel they need an injection, assuming the patient agrees to the injection, then I'll inject them right there. With workers' compensation, they will not allow that to happen. And by allow that to happen means they will not reimburse or approve the charge for that procedure unless it goes through an approval process. So the patient has to leave my office, go through all this bureaucracy and paperwork to get, let's say, injection approved, then come back to me to get that injection if we want to do it the correct way. Sometimes I'm like, you know what, that's just a waste of time. And I'll just do the injection. But it's not the right thing to do. If you want to do it the right way, you're supposed to go through all the hoops. Anyway, my point is this. Workers' compensation definitely is something that is used in the United States. Hernias are among the top work-related injuries, probably after some type of back injury, for which people seek care. And I usually don't get involved in that stuff unless it's complicated and no one else really is there to help. But there are plenty of people that need hernias that are induced as a result of their job. Let's go through, let's see. Let's go through the next set of questions, and maybe here's another question. You previously said that the physical exercise of any kind does not increase substantially the risk of developing a hernia. That is true. To the contrary, it can have a protective effect. That's what the studies show, yes. Why should it be different for a job that involves such exercise? Yeah, we kind of discussed that already, which is, the short answer is we don't know. It sounds contradictory, I understand. But at the same time, what we do believe is that it's A, part of the repetitive action done in a job, and B, people often don't perform their job duties with the same diligence of core protection as they would in the gym, and that's why you have more injuries. What are, according to your experience, the jobs that are most likely to increase your risk of developing a hernia? That's a good question. Usually things that involve lifting on a repetitive basis. So the luggage transportation person at the airport, the delivery of packages person for the postal service, construction workers, that's a big one. Construction workers, the amount of their body abuse that they get as part of their job is crazy. And there's a lot of workers' compensation going on related to construction workers. They lift, they throw, they are just like distorted in weird ways. I once had a plumber that got a work-related hernia, and the way it was is he's like, I have to contort my body to go into these weird holes underneath sinks and underneath homes, and it was that contorting, twisting, weird way that he would have to work that increases his abdominal pressure and then cause the hernia. So that could be a potential cause. Let's see, here's the next question. You mentioned injections, but I'm not sure what you meant. Where do you inject and with what medications? So if you have a strain or a nerve entrapment or other reason for pain that is not hernia related, sometimes you need injection. So that could be injection of local anesthetic. It could be injection of a steroid. It could be injection of a neurotoxin like Botox. It could be a injection related to PRP to help with muscle strains, for example, expedite the healing of that. It could be an injection of hyaluronidase to help hydrodissect to hydrodissect nerve entrapment from scarring. So there's quite a bit of different things. Let's go back to the questions. Let's see. Can work-related activities be the only cause of developing a hernia? So no, and that's where the problem arises, which is we don't really have strong evidence to support why hernias occur. Most hernias occur in people with some type of collagen disorder where there's a weakness in the area of a natural orifice or a natural hole like the inguinal canal or the belly button. And in those patients, there tends to be more of the weaker collagen and less of the stronger collagen. So more of the immature collagen, less of the mature collagen. And that disparity makes it more prone to developing a hernia. So the question is like chicken versus egg. So did the patient already have a predisposition to get a hernia? And you add on top of that they're now a construction worker. So let's say everyone in their family has had a hernia. Then they're a construction worker, and as part of their job, they're lifting bricks, let's say. And then he was about to slip, and during the slip, he kind of controlled his step, and then he felt a pop in the groin. Can that be it? Here's a comment here. Pregnancy caused my hernia. Absolutely. So pregnancy, especially larger bellies, or can cause increasing abdominal pressure. The active labor can cause increase in abdominal pressure, and all that pregnancy is a risk factor for hernias, both umbilical, so in the belly button, and in the groin or inguinal. And sounds like here's a comment. I tried the numbing injections guided by ultrasound, didn't work. Yeah, if it didn't work, then it's not a strain or nerve issue. So nerve issues are best treated with, at least initially, with injections, whereas hernia is not treated by an injection. It doesn't work. Okay. Let's see. What can you do to reduce your risk of developing a hernia if you have a job that is likely to cause it? So first of all, you have to reduce your own personal risk of getting a hernia. So in other words, don't be overweight. Control any coughing. Don't use nicotine, and control any constipation or straining. So that would initially reduce your baseline risk of hernias. You can't change your genetics. So the next step would be to reduce your risk of core injury, and that's back injury as well as hernias. So how do you do that? If your job involves lifting, make sure you are healthy and strong. Exercise, strengthen your core. Do your own weightlifting and strengthen your belly. Do your own Pilates or yoga or other core-based exercises, cycling, swimming. All of those are activities that can now strengthen your core. So then when you go and do activities such as lifting for your job, that you'll do it without straining or tearing, injuring your back or injuring your groin or abdominal wall. And then every time you do an activity, do it correctly. The same way when you're at the gym that your trainer or spotter or whoever tells you to tuck in your pelvis and engage your core and keep your shoulders down and your scapula retracted. Do the same thing when you're lifting. Now that's hard to do if you're doing it for 8 hours and it's the same thing over and over again. But the more conscientious you are, the more you're aware of the fact that you're lifting and don't want to injure yourself, the less likely you are to injure. And part of that would be, for example, some people wear belts or binders. You've seen people that are working at Home Depot, and construction workers wear binders, and your local UPS driver may wear a back brace. It's partially to provide external support as part of their work. Next question. After having a work-related hernia injury repaired, is changing your job the only option to prevent a recurrence? So that's a good question. I had, for example, a carpenter. I don't know if they still do that anymore, but when they were back in the day when carpets were being installed, there's this machine that tucks in the carpet ends underneath the walls at the corners, and the way they would do it is they would use their knee, so they'd be on all fours and they'd jam their knee. I don't know if it's still done. It just seemed like a horrible thing to do multiple times a day, but you'd be on all fours on the floor. You'd stick this thing on the carpeting to push the carpeting underneath the wall edge, like that rim in the wall, and then you just take your knee and jam it. That takes a lot of core, a lot of groin, increases abdominal pressure a lot. Yeah, so if it's a simple hernia and you're a low risk patient, I would say you don't have to change your job. But if it's a complex hernia or it's multiply recurrent, and the reason why it's recurrent is because of your own risk factors and also the type of work you do, then you may want to consider not doing that anymore. So I have construction workers, let's say, that have hernias that see me because that hernia was botched. So then I had to redo the hernia, sometimes with mesh, sometimes with more than one mesh, sometimes, reconstructing the tissues. And I was like, is there any way you could just not do this construction job? It's a lot of additional pressure that every time you tear, that makes it even more difficult the next time, and you can have loss of domain and really bad nerve injuries and scar tissue and entrapment. So, they moved him to like a more of a desk job, but in the same construction company. So yes, there are situations where you would benefit from changing your job and to one that's not so physically taxing. Here's another question. On another note, if you had no pain after a laparoscopic mesh repair, but developed pain several months after, and no recurrence is detected, what other mechanisms can cause late phase pain? I had fibrosis with nerve entrapment, shrinkage, i.e. fibrosis with nerve entrapment, shrinkage, etc. Are you personally always able to predict the right size of mesh? So there's a standard size of mesh, and to go under that standard size puts you at higher risk for A, chronic pain, and B, recurrence. And then in terms of pain, so if you had a laparoscopic hernia repair and you have no pain for, let's say, a year, and then you start developing pain, then usually that's a hernia recurrence. If you had a hernia repair and you didn't have much pain until like around weeks 3 to 6, then that's usually too tight of a repair, and the mesh has shrunk, and it's the shrinking of an already tight repair that's pulling on sutures and pulling on tissues and causing tightness in the area that can cause chronic pain. That's usually the reason. And then if the mesh was put in okay, but then starts folding, usually those symptoms start also around week 3, or it can occur earlier or later as well. And then you'll feel the effects of, let's say, mesh entrapping a nerve, or just balling up and causing pain, or exposing the hernia and causing a hernia recurrence. So those are what happens where there's a lot of reasons why people get pain after a hernia repair. It's not always nerve problem. It's not always a recurrence. It can be the mesh itself. It could be inflammation. It could be a seroma, hematoma, nerve entrapment, scarring, shrinkage, inflammatory reaction, balling up of the mesh, and so on. So there's a lot of like questions and queries and imaging and physical exam and so on that'll help with that. Here's a comment. I had tight stitches. They removed them. They were not dissolvable. They were surgically removed. I'm still having pain. So if you had tight stitches that were removed, did you have mesh, and were they tight that they were causing therefore tearing, and now you're still dealing with the tear? The instigator of the tear is gone, but you may still have those tears. So if it's just a tear, you don't have any other reason for pain, sometimes PRP or other types of injections can help you naturally heal those tears, and sometimes you just need to have surgery to address those tears. No mesh. Yeah, so when you have tight stitches, if you have tight stitches that tore through, and that's what was causing you to have pain, once you remove the stitches, then you either have now a hernia or you have tears that need to be addressed. Scanning will not necessarily see tears. It will see a hernia, but you may have tears without a frank hernia, and what you're feeling are the side effects of the tear. Here's another question. Can a mesh ball up or fold with a TEP laparoscopic angle hernia repair, or does the preperitoneal retrorectus space secure the mesh to prevent folding, balling, and migration. So you can get a meschoma with a tap repair. Depends on the space that is made to accommodate the mesh and how flat the mesh was placed before finishing. Those are usually the top two reasons why mesh can fold. It's the wrong size mesh and the wrong placement of the mesh and the wrong size positioning of that mesh. How do you find tears? So usually it's indirectly, it's not found unless you physically operate. So you indirectly presume there's a tear, you treat it as if there's a tear, because often tears are not treated surgically, they just need injections, often with PRP, sometimes with local anesthetic and steroids. If that doesn't work, then sometimes you need the area explored to actually physically find a tear. But we prefer not to operate on tears and just allow a combination of physical therapy and injections to heal those tears. Let's see. All right, well, that's it with all the questions that were submitted. I'm happy to answer any more questions for you all. This was kind of fun. My voice lasted the full hour. You can hear I don't have a normal voice. It's a little nasally and it's a little like crackly and not crackly. It's just not clear. I'm trying to drink some hot tea. Honestly, I'm tired of cough drops and teas. I feel like I've overdosed on it. Some experts claim PRP can cause calcifications. I don't know that they do. Trauma can cause calcifications. I don't know that PRP can cause calcifications. I've never seen that. That's like it's your own tissue. Why would it cause calcifications? That I don't understand. So let's see, next Tuesday, I believe the day after Christmas Day. So I'll see. I may just be in the giving mood and we'll do another HerniaTalk Tuesday, the day after Christmas Day, because it's been a while and I feel like because of my voice, I haven't been here for you guys. So I kind of feel guilty. I feel like I owe it to you to come back because there are all these great questions. Here's another question. Does milk make hernia parasites inflame, causing pain? So I assume you mean drinking milk, not putting milk on your wound. So there are people that get inflammatory reaction to milk or other animal products. And those patients tend to have autoimmune disorders or an inflammatory disorder to begin with. So if you drink milk and you start getting joint pain, or let's say pain wherever your wound is, then that's really kind of like an Asia type problem where you're reacting to an inflammatory influence on your body, and that's the animal-based products. So you may want to try non-animal based milks like oat milk and see if you get a similar reaction. You should not, because they tend to be low inflammatory. So that's what I can tell you very, very much. So that's it for us. It was fun. I enjoyed it. Thank you very much. I would like to thank you for asking me the questions, and I hope this was helpful to all of you. Every so often I get inspired. When I get inspired, I feel like I have a discussion with someone, or there's a specific patient in the office, and it kind of sparks a topic of discussion. We don't really ever talk about work-related hernia injuries, and it's so common. So I hope that was helpful. So yes, he had an umbilical hernia repair. When he drinks milk, he gets pain at the repair site. I mean, if the milk is giving him bloating and he gets pain, or food gives him bloating, gives him pain, then that's more likely a little tear and or a small hernia that's not seen on imaging. So on that note, please do subscribe to my YouTube channel at HerniaTalk. Go to HerniaTalk.com to answer if you want more questions answered. You gotta sign up for that. It's free. Become a subscriber to my YouTube channel, but also to my podcast, Hernia Talk Live. It's actually pretty good. We have, I think, close to 90 episodes uploaded already of the 150 plus that are from YouTube. So that's exciting. And follow me on Instagram and X, formerly Twitter, at HerniaTalk. And wishing you all a Merry Christmas. Everyone who celebrated Hanukkah, I hope it was happy for you. I wish everyone a great new year. I will see you hopefully Tuesday, right after Christmas. And that would be it for us. Thanks, everyone.